We all experience some strange symptoms from time to time. Often it's nothing to worry about, but sometimes your body is telling you something more serious.
And here with some symptoms to look out for is internist and women's health contributor Dr. Keri Peterson. Keri, good morning.
Hi, Keri.
Good morning. Important to say before we get the conversation going, talk to your doctor if you're experiencing unusual symptoms in general.
Absolutely, because they can be treated and reversed.
Okay, so let's talk first. Now, if you don't smoke, but if you are not around someone who does and you suddenly start to smell what seems like the smell of smoke, it could be actually the sign of a seizure coming
correct.
on.
That is correct. It's called an aura. It's a visual disturbance or an auditory disturbance or an olfactory disturbance that happens about a few seconds to an hour before a seizure is about to occur. And it's caused by nerves firing the brain abnormally. And patients who suffer from epilepsy or seizures often have the same aura every time, so it can serve as a warning symptom to get ready and protect themselves and the environment from injury.
We often hear about the smell of burnt toast. Is that kind of what we're talking about?
Yes, exactly.
Okay, or cigarette smoke, any of those. Okay, let's move on to the next one. Thinning hair can be a sign of thyroid disease.
It can. It can be a sign of either an overactive or an underactive thyroid. And the reason that this happens is our hair has a resting phase and a growing phase, and most of our hair is in the growing phase. When you have thyroid disease, it pushes the hair to the resting phase so it sheds. But if you treat the condition, it grows back.
And there are a lot of treatment options as well.
There
right?
are, and it depends on whether it's overactive or underactive. They're two different treatment plans.
Okay. All right, our next one is cracked corners on the side of your mouth. This could be something more than chapped lips.
It can. If you have red, irritated cracks in your corners, some people think, oh, it's just dry lips, I'll put chapstick on it.
Dehydration.
Right, but it actually can be from vitamin deficiencies. It's often seen in people who have eating disorders, and it's typically vitamins B2, B6, and folic acid. So if you do suffer from cracked corners, start a B complex, eat some green leafy vegetables and some nuts, and it may heal.
Okay.
All right, next surprising symptom, talking about our nails. So what are we looking for when we look at our nails in the
Well, our
shape?
nails can really be a sign of many different underlying diseases. One of the more common ones is called spooned nails, or koilonychia. Normally, our nails, when you look at them from the side, are curved like this.
Right.
When you have iron deficiency anemia, they start to flatten out, and then eventually they start to scoop. So it's like an upside down spoon called spooning, and it's really characteristic of iron deficiency. And if you replace iron in your diet, over many, many months, it will reverse.
Now, what about the pits in your nails? What's the difference there?
So pitting is a different type of nail finding. It looks like little craters, almost like what you would see on the surface of the moon or a golf ball. Little divots,
Indentations.
little indentations. And this is a sign of psoriasis. So psoriasis we characteristically think of as a skin problem with red patches and scales, but it can impact the nails as well. So oftentimes you'll see the pits before you even get the skin reaction, and that is diagnostic of psoriasis.
And there are treatment options too.
And the treatments, first, cosmetically, you can just file it down.
Right.
But you can try topicals. They often don't work because they don't penetrate the nail well. So sometimes you have to take prescription drugs that treat the skin infection or the skin psoriasis to treat the nails as well.
All right, Dr. Keri Peterson, fascinating. Our bodies are telling us a lot, so we got to pay
Thanks, Keri.
attention. Thank you.